remember one of your videos, you were interviewing Gary Tubbs, Tubbs, as you say it. I can't say the American way, but he did mention about the cost of running studies, and he mentioned, I mean, it was tremendous, unbelievable sums he was giving. So let's just talk of that, because that makes everything more difficult, or unbiased studies at least, or studies not funded by the pharmaceutical companies, and studies not funded by the food manufacturing or processed food manufacturing companies. It's really challenging.
Yeah, it sure does. I mean, it's a very sobering discussion anytime you talk about how expensive these studies are to do. And that's the reality of it. You know, if big pharma's got big pockets and they're going to spend lots of money to run these studies showing that their drug is better, are they going to fund a nutritional intervention study? Absolutely not. And same for big food companies. You know, so our hope is NIH, but those grants are pittance compared to what a trial really costs, and what the pharma companies are prepared to spend. And then it comes down to philanthropy, like what Nusi tried to do with a grant from the Arnold Foundation, and then trying to get other donors to help raise money to run these studies. And even that's very difficult. But I mean, hats off to them for even trying. I mean, such a great effort. And there were some studies that came out of it for sure, but not enough, right? We need more of that. And how do we get there? I don't know, but I hope more academic institutions become interested in it. You know, Dr. Jeff Volek just got a huge grant from the DoD for to start researching nutrition research and low carb research. So that's a great start. So there's some hope. I mean, it's not all dismal. There's a lot of dismal stuff here when you think about it, but there's definitely some hope that we're seeing some directions for the future.
And perhaps we shouldn't really dismiss smaller scale studies as well, or publicly funded studies, as citizen scientists like Dave Feldman are doing.
Yeah, for sure. So, you know, Dave Feldman gets so much credit for dreaming up the study, organizing the study, recruiting a team to run the study, and trying to go out and actually get funding and crowdsource it. And get patients. I mean, like, such an amazing grassroots effort. Like, that's fantastic. And then again, going back to Verta Health, so like a private industry can do it to show their program works. Or like Dr. Tro published a 10 patient study that he did at his practice. So these types of things are obviously less expensive to do. They take time, they take energy. You know, not everybody has unlimited amounts of that. But so there are different versions of studies that you can do, but to get the randomized controlled trial with hundreds, if not thousands of people for a number of years, that's cost prohibitive in a number of different ways. So you're right, we should not ignore the other versions of science, and hats off to all those people, whether it's Verta Health, whether it's Dave Feldman, whether it's Dr. Tro, whether it's other clinicians. There was recently a publication about a ketogenic diet for bipolar disorder by this psychiatrist in France who changed the diet for a certain section of the inpatients who are in an inpatient facility for bipolar disorder. So again, he didn't have to spend tons of money for that study. So it's a great example of things that we can do to further the science.
Or even the efforts of, we shouldn't discredit the efforts of the Dr. David Unwin from the UK, who's publishing the data from his own patients, from his own clinic.
Yeah. He's been doing it for years. I mean, he's been doing it for years now, and is not the quality of a randomized controlled trial, but my goodness, it makes you open your eyes and say, hey, he's having some amazing results. Why isn't my doctor getting those results? My doctor should be getting those results too. And so let's learn from what he's doing. Or if you're a doctor saying, I'm not getting those results, so what is he doing that I can change to start getting those results?